A CEO's life hangs on surgery, performed by the doctor she unknowingly saved. Blood drained from Eliza Montgomery's face as she stared at the screen, the doctor's words fading into white noise around her. Aggressive surgery required immediately, 72-hour window, risk of permanent infertility. At 36, the unmarried CEO of Montgomery Tech had just been told that the unexplained pain she'd been ignoring for months was a rapidly growing tumor, threatening not just her reproductive system, but potentially her life. Her carefully constructed world, the company she'd built from nothing, the future she'd meticulously planned, suddenly hung in the balance of a surgeon's skill and the next 3 days. Ms. Montgomery, did you hear me? Without immediate intervention, the tumor could rupture, causing catastrophic internal bleeding. Dr. Rivera emphasized, her concerned eyes studying Eliza's frozen expression. We need to schedule emergency surgery, but our head of gynecological oncology is attending a conference in Europe. There's only one surgeon available on such short notice who specializes in this procedure. Eliza nodded numbly, her mind racing with terrifying questions. Would she survive? Would her board of directors use this medical crisis as an excuse to push her out? And most haunting of all, would she ever have the family she'd secretly longed for, but always postponed for her career? Walking into the surgical consultation the next morning, Eliza's stomach clenched with anxiety. She'd told no one at work, making excuses about a business trip, unwilling to show vulnerability in the cutthroat corporate world she navigated daily. The last thing she expected was to see Dr. Aidan Clark, barely 40, with kind eyes that seemed strangely familiar. Recognition flickered across his face. Before professionalism masked it, Montgomery, he greeted her with a warm handshake. I'll be performing your surgery tomorrow. As he detailed the procedure with calm confidence, Eliza couldn't shake the feeling they'd met before. When he mentioned being new to the hospital, having relocated recently, she interrupted. Have we met? You seem familiar. His hesitation was brief but noticeable. Perhaps, but right now, let's focus on saving your life and, if possible, your fertility. Their consultation was interrupted by an urgent call on Dr. Clark's phone. I'm sorry, he apologized, his voice changing to something softer as he answered. Hey buddy, what's wrong? Daddy can't come right now. Remember we talked about this. I know I miss you too. Put Ms. Chun back on, please. Eliza watched a complex emotion cross his face. Worry, love, guilt, before he returned to his professional demeanor. My 5-year-old son, he explained simply. It's just the two of us since my wife died last year. Not exactly ideal timing for this career move, but sometimes life doesn't wait for perfect circumstances. The vulnerability in his admission struck Eliza deeply. She recognized in him the same balancing act she performed daily, though with different weights on each side. As preparations began later that day, Eliza was struck by Dr. Clark's thoroughness, the way he spoke to her not as the patient, but as a person facing a frightening crossroads. When a nurse mentioned Dr. Clark's reputation for taking on only the most challenging cases, Eliza's anxiety spiked. Am I worse than you've been letting on? She asked when they were alone. He paused, his gaze direct. Your case is complex. Less, but that's not why I took it. He hesitated, then seemed to make a decision. 12 years ago, you funded a medical scholarship for first-generation college students. I was one of the recipients, the son of a housekeeper who dreamed of becoming a doctor. I never forgot the woman who made it possible. Before Eliza could process this revelation, alarms blared from the hallway. We need to move your surgery up, he said, suddenly urgent. Your latest scans show the tumor is growing faster than anticipated. We operate in 1 hour. Lying on the operating table, counting backward from 10 as anesthesia clouded her consciousness, Eliza's last thought was of the strange connection binding her to the man who had cut into her body, a man whose career she had unknowingly launched, who now held her future in his hands. The symmetry felt both terrifying and somehow right. Eliza woke disoriented, the sharp pain in her abdomen bringing reality crashing back. Through blurred vision, she saw Dr. Clark speaking intently with another physician, their expressions grave. When he noticed she was awake, he approached her bedside. The surgery was more complicated than anticipated, he explained gently. The tumor had infiltrated further than the scans showed. We removed it successfully. But he paused, and in that heartbeat of silence, Eliza knew whatever came next would alter her life forever. There was extensive damage to your right ovary and fallopian tube. We had to remove them completely. He held her gaze steadily. Your left reproductive organs are intact, but they sustained some trauma. Your chances of natural conception are significantly reduced, though not impossible. Tears slid silently down Eliza's face as the weight of his words settled over her. She had always assumed there would be time later for a family, after the next promotion, after taking the company public, after proving herself in a male-dominated industry. Now later had a question mark attached to it. There's more. Dr. Clark continued, his voice dropping. The pathology report shows cellular abnormalities that concern us. We need to run additional tests immediately. There's a possibility this wasn't a benign tumor. The next 3 days passed in a haze of tests, specialists, and sleepless nights. Eliza found herself opening up to Dr. Clark Iden in ways she never had with anyone before. Perhaps it was the vulnerability of her situation or the strange connection they shared, but in him she found both the clinical expertise she needed and an unexpected understanding. When he mentioned struggling to find appropriate child care for his son Noah during his hospital shifts, she surprised herself by offering to have her assistant research options. "It's the least I can do," she said. "You're saving my life. I can help make yours a little easier." On the 4th day post-surgery, Aiden entered her room with results in hand, his expression unreadable. Eliza braced herself for the worst. "It's not cancer," he said, relief evident in his voice. "But there were precancerous cells that could have developed if we hadn't operated when we did." The room seemed to brighten as Eliza exhaled months of tension. "However," he continued, sitting beside her bed, "your recovery will be longer than standard. The damage was extensive, and rushing back to your normal pace could compromise your healing." He hesitated. "I understand you haven't told your company about the severity of your condition." "How can I?" Eliza asked, the vulnerability she hated creeping into her voice. "I've spent 15 years proving I'm tough enough to lead. That being a woman isn't a liability. If the board learns how serious this is, that I might need months of recovery, that I'm dealing with reproductive health issues, they'll use it against me. 2 members already think a family-oriented man should be running the company." She hadn't admitted these fears to anyone, not even herself so directly. Aiden's expression hardened. "You funded my education because you believe talent shouldn't be limited by circumstance. Isn't your health deserving of the same consideration?" Before she could answer, his phone rang. The hospital daycare where Noah was spending the day. Aiden's face transformed with alarm as he listened. "I'll be right there." Turning to Eliza, he explained. Noah fell and hit his head. "I have to go." He rushed out, leaving her with questions unanswered, and a growing realization of how quickly priorities could shift. Hours later, when Aiden hadn't returned and no nurse could tell her what happened, Eliza did something unprecedented. She called her COO and told him she needed extended medical leave, effective immediately. The relief of honesty was quickly replaced by fear when her hospital room door opened and a small boy with Aiden's eyes peeked in. "Are you my daddy's special patient?" Noah asked, a bandage on his forehead. Behind him, Aiden appeared, looking exhausted. "I'm sorry," he began. "The daycare couldn't keep him after the incident and I couldn't find backup childcare. I was bringing him to my office when he insisted on meeting you." What happened next surprised everyone, especially Eliza. She laughed, a genuine sound that felt foreign after days of tension. "I'm your daddy's very special patient," she confirmed to Noah. "And I think your daddy is pretty special too." 2 weeks later, Eliza was discharged with strict recovery instructions. To her shock, her board had been supportive, arranging for temporary leadership and insisting her health came first, a response she credited to her COO's fierce advocacy on her behalf. The real surprise, however, was how frequently Aiden checked in on her recovery, their professional relationship evolving into something neither had anticipated. When Noah's regular babysitter quit without notice the same day Aiden was scheduled to perform a critical surgery, it was Eliza who stepped in, working remotely from Aiden's apartment while entertaining a 5-year-old with stories about robots and technology. It was during her 6-week post-op appointment that everything changed. "Again, your healing is progressing well," Aiden said, reviewing her scans. "But I'm concerned about your left ovary. There's inflammation that shouldn't still be present." The clinical detachment in his voice couldn't hide the worry in his eyes. "We need to perform a minor procedure to investigate further. If there's additional damage..." He didn't finish the sentence. He didn't need to. Eliza understood what was at stake. Her remaining chance at biological children. "Schedule it," she said firmly, surprising herself with her calm. "Whatever needs to be done," then more hesitantly, "Would it be inappropriate to ask if you'll do the procedure?" The question hung between them, acknowledging the blurred line between doctor and something more. Aiden's professional mask slipped. "It would be completely inappropriate," he admitted, "which is why I've already arranged for the chief of gynecology to take your case." His hand found hers briefly. "I can't be objective anymore, Eliza, not with you." The second surgery revealed what they had feared. Her remaining ovary was compromised. "The damage isn't irreparable," the new doctor explained, "but natural conception would be extremely difficult. If having biological children is important to you, I'd recommend harvesting eggs immediately for future IVF." The words hit Eliza like physical blows. At 36, with no partner and a major career, she was being asked to make decisions about theoretical future children under impossible pressure. That night, alone in her hospital room, Eliza finally allowed herself to cry for the family she might never have, for the control she'd lost, for the woman she'd been before all this began. A soft knock interrupted her grief. Aiden stood in the doorway out of his scrubs, clearly off duty. "I shouldn't be here," he said quietly. But I couldn't stay away. He sat beside her bed and for a long moment, neither spoke. Then Noah asked about you today. Wanted to know if you were still my special patient. A sad smile crossed his face. I told him the truth that you're not my patient anymore. What am I then? Eliza asked, the question encompassing more than she could articulate. I don't know, Aiden admitted. But I'd like the chance to find out. He took a deep breath. I understand if the timing is impossible. You're recovering, facing difficult decisions, and I have a 5-year-old who needs stability. But something happened these past weeks, something I wasn't looking for and certainly didn't expect. Before Eliza could respond, her phone rang. The board chairman. She answered, listening silently as he informed her that during her absence, her COO had uncovered financial irregularities pointing to embezzlement by 2 board members, the same ones who had questioned her leadership. The company needed her back immediately, recovery or not. I can't, she said finally, surprising herself. My health has to come first. If the board can't respect that, perhaps it's time for new leadership. She hung up, trembling with the enormity of what she'd just done, potentially walking away from the company she'd built from nothing. Did you just quit your job? Aiden asked, stunned. I think I just chose myself, Eliza replied, the realization dawning as she spoke. My whole life I've been proving something, that I belong in rooms where women aren't welcome, that I can succeed where others expect failure. I never stopped to ask what I actually wanted. She looked at him directly. I don't know what I am to you either, Aiden, but I'd like to find out too. 6 months later, Eliza sat in another doctor's office. This time a fertility specialist. Beside her, holding her hand, sat Aiden. The procedure to harvest your eggs was successful, the doctor explained. We retrieved 14 viable eggs, which gives you excellent options for the future. She smiled at the couple. Whenever you're ready to take that step, we'll be here to guide you through the process. Outside in the parking lot, Noah waited. In Aiden's car with a babysitter drawing pictures of the family. He insisted they were becoming a daddy, a boy, and the lady who knew about robots and sometimes cried when she thought no one was looking. Eliza had returned to her company, but on her terms, working remotely 2 days a week, delegating more responsibility and prioritizing balance over perfection. The embezzlement scandal had forced a board restructuring that ultimately strengthened the company and her position within it. Ready for the next adventure? Aiden asked as they walked toward the car where Noah was, waving excitedly through the window. Eliza looked at the man who had first saved her life and then helped her discover what she wanted that life to include. I think I've been ready for a while, she replied, squeezing his hand. I just needed the courage to admit it. As Noah bounded into her arms, chattering about his day at kindergarten, Eliza realized that the greatest revelation wasn't about medical diagnosis or career decisions. It was learning that vulnerability wasn't weakness. It was the gateway to the connection she'd always denied herself. Her journey from that terrifying diagnosis to this moment hadn't been about losing control, but about finding what truly mattered when everything was at risk. Life didn't always give second chances. Sometimes it gave something better. The clarity to see that the first chance had been there all along, waiting for you to be brave enough to take it. And if her story could inspire even one person to listen to their body, prioritize their health, or recognize love when it appeared in unexpected places, well, that would be the most meaningful legacy of all. Vulnerability wasn't weakness. It led her to the life she truly wanted.